Good day, everyone. We are Group 2, and today we will be presenting our research proposal titled Factors Affecting Trust in Bioequivalent Drugs Among Patients of a Secondary Hospital in a Low Resource Settings. So, my name is Gail Cuezon, and I'm here with my group mates, Exequiel Dimaano, Danica, Louise, Duyan, and Sam Lester Taguibao. We begin by outlining the problem and its significance, highlighting the gap in existing knowledge that the study aims to address. Our objectives are clearly defined, outlining the specific questions we attempt to find answer through our research. For the introduction, I'll give a brief background on bioequivalent drugs, generics of Act 1988 in the Philippines, and the research aim. To start, the background on bioequivalent drugs are generic alternatives to brand name drugs, meaning they have the same active ingredients but may contain different inactive components such as fillers and preservatives. Despite the differences, regulatory authorities like the US FDA and the European Medicine Agency ensure that bioequivalent drugs provide the same therapeutic outcomes as brand name drugs. This makes them a cost effective option for the patient. In the Philippines, the Generic Act of 1988 plays a crucial role in promoting affordable generic medicine. This law mandates that healthcare providers prescribe a generic alongside brand names, giving patients the choice of cost-effective cost-effective alternatives. However, despite these measures, misconceptions about the efficacy and the quality of generic drugs remain prevalent. In the end, influencing patients' trust and adherence to these medications. Our research aims to explore patients' concern, understand their impact on trust and adherence to bioequivalent drugs, and address the misconceptions to improve healthcare strategies in a low-resource settings. And now, let's move on to the literature review. Doc X Dimaano, over to you.
Thank you, Karen. I will now discuss some key points from the literature on bioequivalent drugs and the theoretical frameworks that guide our study. Globally, the adoption of bioequivalent drugs varies significantly. Bioequivalents are critical to expanding access to affordable medication and reducing healthcare costs. But how are they perceived and adopted differently around the world? In countries like the United States and Germany, strong regulatory frameworks, cost-saving incentives, and public education have paved the way for higher rates of generic drug adoption. Generics in these regions make up the majority of the prescriptions. The public's confidence in these medications is largely due to the belief that their stringent regulatory systems ensure safety and efficacy. In contrast, regions such as the Italy and Brazil have experienced a slower uptake. Here, initial resistance stemmed from concerns about the efficacy and quality of generics. Patients were skeptical, viewing generics as inferior to their branded counterparts. India, on the other hand, is unique as it stands out not just as a consumer but as a significant producer of generic drugs. Indian generics have become instrumental in providing affordable treatments worldwide, particularly for conditions like HIV. These efforts are a testament to how bioequivalence can be a game changer in global health care. However, we must remember that public acceptance is not uniform. Patient concerns such as safety, efficacy, and trust in healthcare providers significantly affect adherence in bioequivalence. In the United States and Germany, for example, patients' trust in their healthcare systems correlates strongly with high acceptance rates. But in regions such as Italy, Brazil, and the Philippines, misconceptions about generics linger. These misconceptions often stem from cultural perceptions, branding, or a historical preference for originator drugs. Public campaigns focusing on transparency and reassurance from healthcare professionals have proven effective in changing mindsets and boosting acceptance. Studies also show that affordability is a major factor in adherence. Patients who experience significant cost savings are more likely to continue using bioequivalents, particularly if they have strong support from their physicians and pharmacists. Conversely, when patients distrust generic drugs due to changes in packaging or experience a nocebo effect, where negative expectations cause perceived side effects, adherence drops. It's crucial for healthcare providers to actively engage with their patients during a switch from branded to generic medications. By emphasizing the equivalence in efficacy and safety, we can mitigate patient anxiety and improve adherence rates. Ultimately, trust is a fundamental pillar in healthcare decisions, especially regarding medication adherence. Patients need to trust their healthcare providers, the pharmaceutical industry, and the regulatory bodies. Studies consistently show that trust in these entities correlates directly with adherence levels. Building trust isn't just about ensuring regulatory compliance, it's also about effective communication, empathy, and transparency. The theoretical frameworks for our research are the health belief model and the trust theory. The health belief model helps us understand patients' perceptions of susceptibility, severity, benefits, and barriers to using bioequivalent drugs, while trust theory emphasizes the importance of trust in healthcare providers and regulatory institutions and the pharmaceutical industry. Addressing trust issues through transparent communication and education can significantly enhance patient acceptance of bioequivalent drugs. Given these theories, our conceptual framework for our study appear as follows. And that's it for our literature review.
Thank you, Doc Ezekiel. I will now describe the methodology we will use for this study. Our research follows a quantitative, correlational, cross-sectional survey design to explore the factors affecting patients' trust in bioequivalent drugs. The study will be conducted among patients admitted to Madonna Medical Center in January 2025. We will use convenience sampling to gather a diverse group of respondents, aiming for a sample size of 172 participants, which was calculated using Taro-Yamani's formula with a 5% margin of error. We will collect data using a structured questionnaire developed to measure various contracts influencing trust. The questionnaire is divided into sections that assess perceived susceptibility, severity, benefits, barrier, cost to actions, interpersonal trust, and institutional trust. Most items will use a 4-point Likert scale to encourage definitive responses and eliminate neutrality. So for ethical consideration, it is the core of our study. So we identify two core ethical consideration, which is informed consent and confidentiality. So, informed consent will be obtained from all participants, and they will be informed of their rights, including the right to withdraw from the study anytime without any consequences. Confidentiality will be strictly maintained, with no personal identifiable information included in the results, and data will be securely stored with access restricted to the research team only.
Thank you, Danica. I will now discuss how we will analyze the data collected and elaborate further on the ethical aspects of our study. For data analysis, we will use both descriptive and inferential statistics. Descriptive analysis will help summarize respondents' demographic characteristics as well as their responses related to trust in bioequivalent drugs. We will use mean, frequency distributions, and standard deviations to provide an overview of the participants' perception. Inferential analysis will include the following methods: Pearson correlation coefficient. This will measure the strength and direction of the relationship between the trust in bioequivalent drugs and variables such as perceived susceptibility, severity, and benefits. Multiple linear regression analysis. This will evaluate the combined effect of multiple independent variables, such as in healthcare providers, perceived benefits, and perceived barriers on trust in bioequivalent drugs. The chi-square test of independence. This will be used to examine associations between categorical variables such as the source of information and trust levels in bioequivalent drugs. Ethics is an important aspect of our research. Participants will be fully informed of the study's purpose, their rights as participants, and how the data will be used. Informed consent will be obtained in a manner that ensures participants will fully understand the research, and it will be available in multiple languages to address the literacy and language barriers. Confidentiality will be strictly maintained with all personal identifiers removed before data analysis. The research proposal has been reviewed and approved by the Ateneo de Davao University Ethics Review Committee to ensure that all ethical guidelines are met. In conclusion, our study will investigate the factors affecting trust in bioequivalent drugs with a focus on promoting trust and improving medication adherence. By addressing misconceptions and fostering patient centered care, we hope to contribute to making healthcare more affordable and equitable, especially in low resource settings.